Hey friends, welcome back to the Blueprint Nursing YouTube channel. My name's Nicole, and today we're talking about an emergent complication of labor, shoulder dystocia. And after our review, we'll check out an NCLEX style question to test out our knowledge. Let's get started. Shoulder dystocia is an emergent complication of vaginal birth. As you might recall, the fetus will go through a series of maneuvers as it is delivered. We'll also recall that labor and birth are affected by factors that are known as the 5 Ps. Do you remember them? They are passengers, so fetus and placenta, passageway, the birth canal, powers, contractions, position, maternal, and psychologic response, maternal. So, how does this relate to shoulder dystocia? Well, this occurs when there's a mismatch between the passenger and the passageway. The head of the infant is born, but the infant's shoulders are unable to pass through the maternal pelvis. Let's talk about risk factors. These factors don't mean a shoulder dystocia will happen, but they are definitely factors that help us, as nurses, prepare for the complication of shoulder dystocia. Maternal risk factors include diabetes, gestational and pre-existing, demographics like height, advanced maternal age, number of pregnancies, pelvic abnormalities, excessive weight gain. So this is how much weight a client gained during their pregnancy. In my work experience, a gain of over 40 pounds during pregnancy was noted. Previous shoulder dystocia, post-term pregnancy. We're looking at 42 weeks and 0 days gestation or more. Fetal risk factors include estimated fetal weight of greater than 4,000 grams. It's about 8.8 pounds, and male. What is notable is that the risk factors highlight the potential of passenger versus passageway mismatch. Signs that a client is experiencing shoulder dystocia may include second stage of labor slowing down or caput succedaneum. That's the swelling of the fetal scalp, increasing in size. The hallmark sign of a shoulder dystocia is the occurrence of the turtle sign while the client is pushing. This is when the fetal head retracts towards the maternal perineum after its emergence. So, the fetus is trying to deliver, but is almost pulled back because it's stuck. This is an emergent complication because the fetus is at risk for asphyxia if the fetus isn't delivered in a timely manner. After the delivering provider confirms the presence of shoulder dystocia, the team will work together to perform maneuvers to release the anterior shoulder from behind the pubic bone and ultimately deliver the infant. Let's review the most commonly used maneuver, McRoberts maneuver with suprapubic pressure. So, in this picture, you'll see that the anterior shoulder of the fetus, the fetal shoulder closest to the maternal anterior pelvis, gets stuck behind the maternal pubic bone. McRoberts maneuver involves the hyperflexion of the client's legs against their abdomen, which changes the shape of the pelvis to open up the space for the fetus to deliver. Suprapubic pressure is applied to compress the fetus's anterior shoulder to further increase space for the fetus to deliver. This maneuver is less invasive than other maneuvers and is easy to learn among staff. Complications are going to be related to the traumatic nature of deliveries that occur with shoulder dystocia. So fetal complications related to shoulder dystocia include a fractured clavicle or humerus, brachial plexus injury, or asphyxia. Maternal complications related to shoulder dystocia include postpartum hemorrhage or a 4th-degree tear, and that's a tear that involves the perineal muscle and rectal sphincter. Prevention measures related to shoulder dystocia would revolve around monitoring for the occurrence of any risk factors in a pregnancy. So, regular prenatal care is key. Prenatal care allows the provider to monitor maternal weight gain during pregnancy, pertinent medical history, and estimated fetal weight. Clients with confirmed risk factors would collaborate with their provider to assess whether a vaginal birth or a cesarean section would be the appropriate method of delivery. All right, let's go over a practice question. The nurse is planning a staff education program about shoulder dystocia. Which of the following risk factors should the nurse include? Select all that apply. Option 1, estimated fetal weight greater than 4,000 grams. Option 2, gestational diabetes. Option 3, preeclampsia. Option 4, preterm labor. Option 5, previous cesarean section. Option 6, previous shoulder dystocia. All right, take a second here to pause the video, review the options, and press play when you've selected your options. Ready? Okay, so this question is looking for us to know the risk factors associated with shoulder dystocia. The answer is option 1, option 2, and option 6. We see these with shoulder dystocia because they tend to lead to a mismatch between the passenger and the passageway. You got it. Preeclampsia, preterm labor, and previous cesarean section are all conditions that aren't necessarily associated with shoulder dystocia. All right, that wraps up our review. Here's a look at the materials we used to make this review. Thank you so much for joining me today. Don't forget to subscribe to Blueprint Nursing's channel to keep up with the latest videos. Check out Blueprint Nursing on TikTok and Instagram, and definitely take a look at our live study group options. See you next time.